I think I've overcorrected as a educator. I think I'm what I would have wanted as a medical student or as a resident, but I'm coming to learn that that is not what every resident needs. When I was a resident, especially as a senior resident, I found that didactics were too slow. That if an attending asked a question, there would be that uncomfortable 10, 15 second pause where it became clear immediately that no one knew the answer to the question, but you still sat in that silence regardless. And I hated that, I just wish, I don't know the answer. Do you want me just to flub out an incorrect one before you say the right thing? Or what do you want here? I hated those moments. And I was tasked for doing a talk for the residents recently to go over electrolyte derangements, all of them, in half an hour, which is admittedly too much. Because nephrologists find a whole career out of a lot of these things. So I tried to piecemeal together lectures I had that I gave in residency, like a 45-minute lecture on sodium, 45 minutes to an hour on potassium, and an hour on everything else. And it was too dense and I think a little too fast, much too fast. I should have just separated it out and just said today, half an hour, we're only going to talk about potassium. But one of the things I hope I figure out better over the next, 20, 30 years is how can you concurrently teach for the third-year medical student on a rotation who wants to go into pathology as much as the intern in EM or the third-year resident or the third-year resident who wants to go into critical care or tox or pediatrics or general practice in a rural, low-resource community. It's hard to teach for all of those people in mind. And I tried to do that at different levels of teaching, right? Like intern, hyperkalemia. How do you treat it? What are the meds? Second year, what are the assumptions about those meds? Can their heart handle the myocardial demand from albuterol? Can they even urinate if you're giving them Lasix? If they have poor renal clearance, what's the pros and cons of 5 of insulin versus 10? And the nursing demand that giving 10 of insulin for someone on dialysis, what will that do for the department as a whole? But I think it came out a little too muddled, so I need to work on that. But I think even if I'm 1 to 2% better on every talk I give, in a couple of years, I think I'm gonna figure some of this out. All right, have a good shift.